Welcome to Module 2, Special Populations. I hope that you enjoyed Module 1 and feel that you have a foundation of knowledge for SEL and APL standards. In this module, you will be looking at special populations of children that may need additional support for their SEL and APL skill development. There will be a distinction made between the universal approach of looking at and planning educational strategies for all children, contrasted with the importance of addressing each child's individual needs and tailoring interventions to meet individual needs. The topic of building a solid social-emotional foundation for children, behavioral challenges, and how to set children up for success will also be included. This slide is a reminder of the icons that will be used throughout the module. When you see a particular icon, it is indicating that you will either be referencing one of the three booklets or completing an assignment. Please remember that you can pause or stop this video if you need additional time to review the slide. You can also rewind the video if you need to return to a previous slide. These are the learning objectives for this module. Please take a moment to review them. Elaborating on the second bullet, a universal strategy to address children's social and emotional needs in the educational setting could be to incorporate a quiet corner. While all children would benefit from it, a child from a special population would benefit more if it was customized to his or her specific needs, i.e. sensory materials would be available for a child with ADD, a dual language learner would find books to read in his or her home language. The main point is that all children need a nurturing and supportive learning environment, but some children also require additional support or services tailored to meet their specific needs. This is the agenda for Module 2. We will be looking at the needs of all children and then with a more refined focus on children from special populations. Neuroscience is telling us that this birth to 5 is one of the most important periods for developing self-regulation, problem-solving, social-emotional, and language and communication behaviors. This is because the brain is growing at a more rapid rate between birth and 5 than any other time in life. In brief, neurological connections are wired in the brain, creating a framework for skill building throughout life. The connections that are used frequently are strengthened over time, while the connections not used are pruned back. Repetition and practice are needed to build and strengthen neurological connections. Educators should provide many opportunities to practice skill building to strengthen these connections. Without the opportunity to practice and to use the skills, the connections could be pruned back. The brain is constantly wiring and rewiring for optimal use. If a child does not participate in skill building for specific skills, no neurological pathway will develop for that skill. There are windows of learning for people in which certain skills are easier to learn at certain ages and at different brain development stages. If the window is missed, the skill can still be developed, but it will be more difficult to learn. If a child doesn't learn and practice skill sets, then the brain doesn't wire for it. When children arrive at school, if the wiring is not there, educators must start at an earlier place because their chronological age does not align with their developmental age. It's important to note that there is no one cause for developmental delays, and brain scans of children with developmental delays look almost identical to typically developing children. With that said, there is a 90 to 100% chance of developmental delays in children with at least 6 toxic stressors such as poverty, maltreatment, single parent, or mental illness of a caregiver. Remember the continuum? All children can make progress, but we have to begin by meeting them where they are developmentally. If we have higher expectations than where their current skills are on the continuum, then educators and children will both be frustrated and disappointed. It's best and easier to meet them where they are and facilitate growth from there, with the end goal being the competencies and examples of evidence described in the standards whenever the child is able to achieve them. Before moving into special populations, we will take a look at what is needed for all children to develop a solid social and emotional foundation. The next 5 slides address how we, caring adults and communities, build a strong social and emotional foundation for children to succeed on the continuum of SEL and APL. This slide series depicts the foundational work that's needed to take place in early childhood to achieve later success. Take a moment to review this slide. Although it takes a village to raise a child, a healthy, positive attachment to a primary caregiver is critical to growth and development. The plant analogy relates to children's growth and development. Some examples of the kind of nurturing that children need are nurturing environments, secure attachments, serve and return interactions, which is like a tennis game with interactions going back and forth between parent caregivers and children. This relates to the continuum slides on Module 1. Even with a lack of care or other impediments, the plant can be revived, but if this happens too often or the right mixture isn't found, the plant's development will be impeded. The right mixture of light, water, and soil is necessary for the plant to thrive, and it works the same way for children. Each child will need an individual mix of nurturing to help them succeed. They need adult support to develop a root system strong enough for them to succeed. Growth is not limited for children from special populations. With attention and engagement, they can also make big strides on the SEL continuum. For example, a child who presents with delays due to neglect and then is placed in foster care can begin to thrive if the environment is stable and nurturing. Watch the growth of the plant on the bottom of the slide and note the regression during its growth. Although children follow a general continuum of growth, there are circumstances that can lead to regression along the continuum. As noted in T. Barry Brazelton's touch points, when a child seems to regress in one domain, they are often having a growth spurt in another domain. This slide depicts the continuum of growth that all children follow. Some take longer and some are faster due to positive experiences, genetics, and access to resources. With the right mixture of attention, guidance, and skill building, all children will move along the continuum. Remember, all children need to be viewed as individuals with varied needs. No one size fits all for all children or plants. Think about Christian's vignette from Module 1. His initial root system was challenged due to early medical complications. This was counterbalanced by attentive parenting, good medical care, and extended family support. When the early educator and parent work together with Christian, more opportunities to develop a deeper and stronger root system are created. Notice this impressive root system on the slide. This is the goal for all children and is possible for all children. Due to a variety of risk factors such as medical complications, trauma, poverty, etc., some children's root systems or social-emotional skill development may not be as well developed as hoped. This may not always be visible, so pay careful attention to the individual progress of each child. Children without a history of secure attachment and responsive and nurturing relationships may need more than a typical child. Many children have most of their developmental needs met at home. Educators need to pay special attention to the children without this nurturance in their history and at home. To get back to the plant analogy, these are the plants that need the extra light and water, which would be nurturing, consistency, and responsive attention for a child. Everything educators must do for typical children needs to be done more often and must be intentionally individualized for special populations, while including them as much as possible in every aspect of the early education setting. We will explore inclusion in the context of equity and equality later in this module, but a quick word. Equality means that all children receive the same instruction and those for whom it is a good fit will succeed. Equity means that all children get what they need to succeed in learning. It's important to identify the strengths that all children bring, but especially true for children from special populations. This is our responsibility as educators to provide the extra support, stable environment, safety, empathy, consistency, acceptance, and connection for these children. I encourage you to think about ways that you can deepen and strengthen the root system for all children. There are many things that go into a recipe for success. With these three, a supportive, safe, and stimulating environment, healthy brain development, and consistent and responsive caregiving, the likelihood of a child experiencing success in the education setting and life is much greater. As you saw in Module 1, this is a connecting to the standard slides. It looks at ways to support a child with a particular SEL or APL in the education setting. This slide describes strategies for all children. The second, connecting to the standard slide in this module, will focus more on special populations. Just as a reminder, for SEL 8, in order for a child to engage socially and build relationships with other children and with adults, educators need to support, guide, and give opportunities for children to practice the skills. It is also just as important for adults in their world to model this type of behavior in relationship building. There are a number of experiences that may impact growth and development of social emotional skills and ultimately impact SEL and APL in the early education setting. This is not meant to be a comprehensive list, and I encourage you to take a few minutes and see if there's anything missing. These examples illustrate children's varied experiences which may delay growth and development of SEL and APL. However, this is not always the case. Children are very adaptable and resilient, and experiences affect children differently. The SEL development of a child from a different cultural background who is possibly acquiring English as a second language may seem slower, but if properly supported, those same elements will provide him or her with strengths and opportunities for enhanced learning and growth. This is why it's important to look at the whole child individually and create a plan for their success on an individual basis. You might ask, how could these factors affect social emotional development? An example might be with safety and medical issues, the parents may do too much for a child due to vulnerabilities or complications, which may challenge the child's ability to become independent. Or the parents may not have their own SEL and APL skills to model and scaffold for their children. Various cultures have differing expectations and valuations of SEL development. The child may be experiencing different cultural expectations at home and in the education setting. This would be the Bridging Different Cultural Expectations bubble on the slide. You may want to read the Adverse Childhood Experiences Study, the ACEs study. The ACEs study information can be found at www.cdc.gov/violence-prevention/ACE study. Research is clear that adverse childhood experiences impede children's growth and development. For children who are focused on daily survival because of violence, neglect, and abuse, their neural pathways are wired for survival, not skill building. Adverse experiences lead to disrupted neural development, which leads to social, emotional, and cognitive impairment. I would like to take a moment to address the issue of chronological age versus developmental age, as this is especially relevant for some children in special populations. In cases where children experience delays, it is possible to have a child who is chronologically 6 but has the social skills of a 3-year-old. When supporting social emotional skill building, it's important to note how old the child is, but more importantly, where they are developmentally. Take a look at any of the examples of evidence in the standards booklet for SEL and APL standards. You might assume that because a child is chronologically 6, they would be at or near the skill level described in the examples of evidence section by the end of kindergarten a child may. If the child has delays in the social emotional realm, putting him at the developmental age of 3 years old for social emotional skills, those examples of evidence may not be appropriate for that child. This is where you would need to look at where the child is developmentally and use the examples of evidence for that age instead of their chronological age. For this course, we will be defining special populations as children from groups that share common characteristics that impact their learning and development in the educational setting. Some examples of special populations from the previous slide include a specific disability, multiple risk factors, little or no previous school experience, low socioeconomic background, and linguistic differences such as dual language learners. It's important to remember, however, that any child may experience learning difficulties. For example, a great reader may struggle in math. A visual learner may have difficulty learning a new spoken language. All children need a nurturing and supportive learning environment, but some children also require additional supports or services tailored to meet their specific needs. The next slide looks at two different approaches to addressing differences. Equality refers to sameness. Everyone gets absolutely equal treatment and the same resources. But that treatment doesn't take into account the individual needs or the history of each individual. In this illustration on the slide, equal treatment does not result in equal experience. Equity refers to fairness. Everyone gets what they need based on their individual needs and history. For all children, educators need to look at their individual needs and what environmental and instructional supports they will need to be successful. However, with special populations, additional services may be needed to support their development and help them succeed. To describe equity and equality, please look at the visually impaired example on the slide. In terms of equity, a child with visual impairment may need additional boxes like materials in Braille and sitting in the front of the room. With equality, all children would have the same books and have random seating. A dual language learner example, dual language learners would need boxes with visual prompts and books in their own language. With equality, all children would have access to the same books and material. From a social justice perspective, children who are labeled as being from special populations typically include a disproportionate number of children from global majority. This is considered to be a more respectful and accurate term than the more commonly used word minority to describe non-white people. It is based on the fact that 85% of the world's population is not white, therefore the term minority is not factually accurate and is based on historical bias in Western cultures. The principles of equity and diversity in early childhood education are interconnected and cover a broad range of ideas. They require professionals to actively address issues of inequality and to promote the value of diversity and difference. Here are some other examples of equity and equality in the education setting. This is your first assignment for Module 2. This is a two-step assignment. You will need to identify and contact a discussion partner. The discussion partner should be a colleague who has an interest in SEL and APL. If you cannot identify a partner, please contact your facilitator immediately. You will then discuss the following questions with your partner. Take a moment to review the questions. After having your conversation, you will write at least 250 words addressing the statements on the slide and reflecting on your conversation with your partner. You can access the journal by returning to Blackboard, going to Module 2, and clicking on the link for Journal Module 2. Please remember that this assignment is due by Wednesday of the second week of the course. Moving back into course content, CSEFEL is an acronym for Center for the Social and Emotional Foundations of Early Learning. It is being transitioned into being called the Pyramid Model now that the federal grant that originally funded it has ended. Although the Pyramid Model and resources are currently being housed on cefel.vanderbilt.edu, they are being transferred to pyramidmodel.org. Each state must now determine where the CSEFEL/Pyramid Model information will be housed and how it will be promoted. The Pyramid Model Consortium will be the organization created in Massachusetts to house and promote the Pyramid Model. Currently, due to limited funding, many of the resources remain on the Vanderbilt site. You can find the link for the resources on this slide. This Pyramid Model is designed to promote social competency and prevent challenging behavior in young children. The idea is to promote social emotional development by providing support for children's appropriate behavior and preventing challenging behaviors with increasingly targeted and intentional strategies to support the children who need this level of intervention. All children need the supports reflected at the blue level of the pyramid. However, certain children who may be at risk due to circumstances that may not be supportive of their social and emotional development need more targeted and individualized supports to be successful. A few children will need intensive interventions to address their social and emotional development. Many of these children have experienced chronic toxic stress that has severely impeded their social and emotional development. Take a moment to review the different levels of the pyramid. Ongoing assessment is needed to determine additional supports for special populations, as well as to identify where children's needs fall on the pyramid. This course will cover formative assessment in Module 4. The CSEFEL or pyramid model addresses children birth to 5. Many public school educators may be more familiar with RTI, Response to Intervention, which is used with children in kindergarten through 12th grade. Some preschool educators also use RTI. RTI is based on the premise that supports are provided early, monitored systematically, and adjusted intentionally to respond to individual children's needs, thus preventing the more traditional practice of waiting for a child to demonstrate failure and then beginning the process of evaluation and referral to special education. Primary tier prevention starts with all students being exposed to core curriculum to prevent later problems. Regular screening identifies students who are unsuccessful in response to instruction with only the core curriculum. Secondary tier prevention is targeted to at-risk students who need some additional instructional support beyond core curriculum. Tertiary tier prevention is generally more intensive and individualized and is carried out to remediate academic performance or reduce complications or severity of a behavioral problem. Do any of these children seem to belong to a special population? They all look like typical children. Here's more information about these children that is not obvious from their pictures. This first child has multiple risk factors, such as a mother with mental health issues and a family living in poverty, but she also has good confidence and competence, which is SEL 3. The second child has little or no previous school experience, but is persistent and engaging with everyone, which is SEL 8, and has great problem-solving skills, which is APL 3. This third child is a recent immigrant and dual language learner. She also has good impulse control and stress management, which is SEL 4. The fourth child is in a wheelchair, but has good all-around SEL and APL skills. Is she from a special population? Maybe based on her physical abilities, but she has advanced SEL and APL skill development. It's important to remember that children from special populations have SEL and APL strengths just like other children. It's also important to look at the whole child, build on their strengths, and identify and provide the specialized support that the individual children need. Just as a reminder, all children are unique and have their own set of strengths and areas to grow. Individualizing support for children is key. This is your second assignment for this module. There are 2 parts to this assignment. You will first create a discussion board post of at least 250 words addressing the statements on this slide. These directions can also be found on the discussion board under Module 2 Discussion Forum. This first part is due by Sunday of the second week of the course. The second part will have you respond to at least one other participant's post and suggest 2 skill-building strategies that could be used to strengthen one SEL and one APL competency that are challenging for the child described by that participant. This part is due by Wednesday of the second week of the course. This slide was also presented in Module 1. It is revisited here to make the point that children from special populations move along the same SEL and APL learning continuum as other children. They have SEL and APL strengths and, like other children, need individualized supports and services to help them progress along the continuum. For example, remember the marshmallow video? One might say the child who just reached out and started eating the marshmallow was at one end of the continuum for impulse control during the marshmallow experiment, and the child who worked so hard to teach the younger child about the advantages of waiting was at the other end. Research is clear that children from special populations do best in an inclusive educational setting as opposed to being in substantially separate settings. When students with disabilities are in inclusive classrooms, they show academic gains in a number of areas, including improved performance on standardized tests, mastery of IEP goals, grades, on-task behavior, and motivated learn. learning. And inclusive early education settings provide numerous opportunities for children to find similarities and form bonds with one another in daily interactions and learning experiences. They offer a chance to observe and accept that people are all different, yet our differences also make us unique and special. Interestingly, and perhaps not surprisingly, all children do better when their families actively engage in their children's learning. Engaging the families of children from special populations and recognizing their strengths is even more critical than it is for typical children. Research has shown that when families are actively engaged in their child's learning, children are better prepared for school and achieve at higher levels. Increased participation by families in preschool programs has also been linked to greater academic motivation and stronger social and emotional skills among all young children, regardless of ethnic or socioeconomic background. Looking at this connecting to the standard slide, take a moment to reflect on ways that you could modify one of the suggestions to specifically support a child from a special population. Often, when working with young children, we must interpret their needs based on their behavior. It's important to remember that behavior is always trying to convey a message. Children may display, quote, challenging behavior because they do not have the skills to meet their intended needs. Another way to think about challenging behavior is that such behavior occurs when children can't solve their own problems. Positive discipline focuses on understanding the behavior, meeting the child's needs, and teaching the child what to do in place of a challenging behavior instead of what not to do. Think of an example of a child with ADHD, a child who may have difficulty with an APL-3. What behavior might you see on the surface, and what unmet need is just below the surface? SEL and APL skill development often helps manage children's behavior in the educational setting because it teaches them to recognize, understand, and express their feelings and needs, and provide them with effective problem-solving strategies. This slide is based on a quote that describes techniques that can be used for scaffolding SEL and APL skills. The most effective social skills interventions for students with disabilities involve a combination of modeling, coaching, practice, feedback, and other methods derived from applied behavioral analysis. Although all children need support and guidance, children from special populations need more. Educators need to be creative in designing methods to meet the individual and specialized needs of children from special populations. This will ultimately assist children from special populations in moving along the SEL and APL continuum, which is what we hope for all children. For example, if an educator wants to support children with disabilities to increase their APL-3 skill level or ability to maintain focus and attention and complete tasks, he or she may use all four interventions. First, modeling, by demonstrating how he or she sits for whole body listening. Coaching, by providing individual children with prompts and encouragement for listening behaviors or completing tasks. Practice, by reminding the class regularly what, quote, finishing steps are expected for each center or activity. And by providing feedback, by adding stars or checks to behavioral charts that track how often the children demonstrate the skills successfully. Children can become stuck on the continuum, and this is a common concern about children from special populations. Other factors such as low socioeconomics, trauma, neurological complications, straddling different cultural expectations may slow or reverse SEL skill development at times. Because of this, the typical methods in place in the classroom environment may not be enough to support a child from special populations. Scaffolding is critical to helping children move along the continuum of growth. Just as a reminder, in the field of education, the term scaffolding refers to the process in which teachers model and demonstrate how to solve a problem and then step back, offering support as needed. Psychologist and instructional designer Jerome Bruner first used the term scaffolding in this context back in the 1960s. The theory is that when students are given the support they need while learning something new, they stand a better chance of using that knowledge independently. Scaffolding relates to SEL and APL skill development particularly in relationship to children from special populations who may need additional support for skill building. Ongoing interactions and positive experiences build upon one another. The educator's role is to scaffold, starting where the child is and building gradually upon those skills. Whether the child is from a special population or not, scaffolding is key. You can't expect a child to master a skill if they don't have the building blocks beneath it. Referring back to slide 25, the APL connecting to the standards slide, one example of scaffolding could be the kindergarten supports, setting up a designated work area and encouraging children to continue to stay until the project is completed. Educators might also use visual prompts to remind the children to clean up before leaving a work area. The next slide gives an example of visual support that scaffolds expected behavior for circle time. This slide is an example of a visual prompt that scaffolds expected whole body listening behavior for circle time. This slide is based on the following quote: "The most important steps programs, schools, and states can take in preventing, severely limiting, and ultimately eliminating expulsion and suspension practices in early childhood settings are combining developmentally appropriate and non-discriminatory discipline, procedures, and policies with targeted workforce professional development focused on promoting the social, emotional, and behavioral health of all children and enhancing teacher and provider self-reflective capacity to prevent and eliminate bias in practice." Some statistics about the prevalence of preschool expulsion are that over 10% of preschool teachers in state-funded pre-K programs reported expelling at least one preschooler in the last year, a rate more than 3 times higher than estimates for teachers of K through 12 public school students. Of course, you also need to remember that public school educators often have access to more supports and resources than preschool educators do. A recent federal policy statement describes some of the negative consequences of preschool expulsion as early suspension, expulsion, and other exclusionary discipline practices contribute to setting many young children's educational trajectories in a negative direction from the beginning. This has long-term consequences for children, their families, and the schools that they will later be attending. Expelling a child is likely due to a child not being able to solve a problem on their own, which relates to slow SEL development, which may be due to previous experiences. Their behavior is the way a child communicates that they need support and guidance to develop the needed SEL skills to be successful. When they are expelled, they are being penalized for the lack of skills that is truly not their fault. They need support to develop the skills, not termination. This slide covers much of the material covered in Modules 1 and Module 2. It points out the importance of a positive learning climate, which is especially important for children from special populations. The meta-analysis that was mentioned in Module 1 clearly demonstrates that SEL programming significantly improves children's academic performance on standardized tests. Moreover, compared to control groups, children that have participated in SEL programs have significantly better school attendance records, less disruptive classroom behavior. In addition, they report liking school more and perform better academically. The research also indicates that children who have participated in SEL programs are less likely than children in control groups to be suspended or otherwise disciplined. These outcomes have been achieved through SEL's impact on important mental health variables that improve children's social relationships, increase their attachment to school and motivation to learn, and reduce antisocial, violent, and drug-abusing behaviors. The research also indicates that SEL programs with the best outcomes are multi-year in duration. Use interactive rather than purely knowledge-based instructional methods and are integrated into the life of the school rather than being implemented on marginal add-ons. Ultimately, our goal is to help all children develop strong social emotional skills, which will help them in the short term and throughout their lives. Please take a moment to review the key points from this module. This concludes Module 2 PowerPoint. Please return to Blackboard and complete your assignments if you've not already done so. Please be sure to also complete the assessment of learning for this module. Thanks.